Now, ladies and gentlemen, we feel honored to have our honorable chief guest with us today, Shri Professor Raja Babu Pawar Sir. Sir is Vice Chancellor of Rajasthan University of Health Sciences, Jaipur.
Professor Raja Babu Pawar is member of Board of Governors of Medical Council of India, New Delhi. Again, I would like to add on that Sir is a member of PG Committee of Medical Council of India. I'm glad to introduce him as he has published more than hundreds of research papers in national as well as international peer-reviewed journals. Sir has introduced the first mobile cathedral lab in India, which is one of the unique and remarkable achievement. Please, sir, enlighten us with your valuable words. So, all the ladies and gentlemen, please welcome Sir with the thunderous sound of clapping.
Good morning to everybody. Distinguished guests who have come all the way from abroad, from the Japan, and other dignitaries from the different part of the country and from the Jaipur, as well as the students and the faculty, very learned faculty of the Biyani College, Girls College. It is a great pleasure for me, pleasure and proud to be here on this dais, on the occasion, very important occasion, where there's a bilateral relationship of the India and Japan, and the kind of the function is being organized on a common platform for the exchange of the knowledge, for the deliberations, for the presentations, for the interaction between the scientists, the students, teachers of two countries, to bring something new, to make the old new, to make good researches, to just bring the good results, to serve the humanity directly, indirectly. This is the occasion where we can talk something about the conference, which is going to be not going to be, which is today, I think, finishing, and that has been started 3 days back. First of all, I would like to extend my all the regards and thanks to the organizer of this conference for inviting me and given this opportunity to interact with all of you. Whatever here it is written, that that's a stress, all around there is stress. The stress of work, the stress of studies, the stress because of the competition in the field of research as well, in the field of studies. You must have heard of, if you will start, the prevalence of the stress amongst the students. That's very high. You must have heard of that many suicides have been taken place amongst the students who are just preparing themselves for the competitions, various competitions, whether that's in the field of the medical and others. Then stress at the place of the work, at the place of the studies. There are many types of these stresses. Then how to deal with, because the stress is a mechanism, if you will just express in the terms of science, then it is an interaction between the cognitive function and the environment. That's very important. We have to modify the cognitive functions, and we have to, whatever the behavior result because of the change in the environment or whatever the competitive environment is there, we have to modify to prevent the stress. Because of the stress, we know there is a release of the various cortisols and noradrenaline, that's the catecholamines, which ultimately leads to the various hazardous effects on the body in the terms of the impairment of the mental health to the various diseases, including the coronary artery disease, hypertension, peptic ulcer, and many other diseases. And second point, whatever here, they have just written the various drugs role in the stress resilience. Do you understand? I hope everyone understand what is the resilience. Resilience is bring back to the normal. Whatever the stress you had and what are the impacts, which are ranging from the mild impairment to that of the mental illness or various other diseases, bring them back to the normal. And third is, that is factor influencing the work stress at work, that you know very well, because if you are supervisor, if you are subordinate, if you are simple worker, many kinds of the stress are there, because whatever you want to do, that is not being done. There's adverse remarks against you, and the things are very competitive for the promotions. Then there are the various ways to bring it down that I just read somewhere. You should remember 4 A's. To the A is either avoid, alter, adaptation, and fourth one is, that is acceptance. At the work, if there is any kind of the stress, to try to avoid the things as far as possible, and try to learn to say the no. Because if you are committed years and you are not able to do that, that causing a great stress. If you have committed something to your superior and if you are not able to do, there is definitely a stress you are not able to do and whatever you have committed. And then second is that try to alter, modify the things, modify the situations, that try to see that in one way if you are not able to do, try to compensate by other mechanism. That is the thing, you can alter the situation and try to minimize your stress. And third is, that is adaptability. Either you accept the things and adapt accordingly and go work as you are doing and don't worry about that. That's a kind of adaptation. Hear from the 1 year and just forget the things. And finally is the acceptability. You accept the situation, you have to do, you have to done, and finally you did whatever the way your superior and other people around you wanted. These are the few things by you can avoid the stress, and by various interventions also, that at the community level, at the primary prevention level, and the secondary prevention also. Then after getting the illness, there's a treatment. There's many kind of the yoga and meditations which relax you. For the relaxation and diversion, there are the many mechanisms. One thing which I know and I have seen also and practiced many times, that whatever the things you are facing which is responsible for the stress, you have to find out, first of all, what is the root of this stress. Then try to just adapt to that situation. Try to adapt, whether it is emotional, whether that's a physical assault, whether any kind of the other things, you try to just think it minimum possible and divert your attention. Then how to divert your attention? That is, that never leave alone yourself in the situation of the stress. Always mix up with the people, with the good friends. Talk with them, play with them, walk in the morning, do the exercises. All these things divert your attention, and ultimately that reduces your stress and strain. And second thing is that you should play, do the exercise, do the meditation. These are very important things to relax yourself, and ultimately the level of stress will go down. Music is also a very good thing, and if you just divert yourself and focus and concentrate on the music and dancing, the music and as well as the exercise, they release endorphins, and ultimately that's responsible to minimize your stress. These are the few things which we just discussed about the causes of the stress, how to avoid, how to prevent, and newer methods, artificial intelligence, M-health, E-health, to reach to remote areas and communities, to intervene various people to minimize their stress. Many people like to start loving to their pets and start morning walk with them, long walks. That also reduces the stress, divert your mind, and just give and facilitate the healthy mind and healthy perceptions. These are few ways and means. Now I come to second point, that Biyani brothers, they are doing the good job, and they brought this Biyani college in very close to Japanese universities. And just before me, Dr. Biyani just emphasized two things. One is the reciprocation, bilateral understanding and exchange program, and the research as far as in collaboration as far as the research is concerned to materialize. These are the very important issue. Then certainly I would like to suggest that they should encourage more and more bilateral affairs with the Japan and other countries also, so we can just transfer the technology. Whatever we have, we can give to them, and whatever the way they are better, we should bring that and combine together and produce the best possible things. Biyani was talking about the sensors. These are the sensors about which and markers which are important to detect various kinds of the cancers. Here I would like to suggest my viewpoint, that what are the issues in the field of the cancer so far which are important and need any kind of the revisit to understand the mechanism of cancer and the treatment. Because here the many scientists who are working on the field of the research, they are trained in biotechnology, where they're using various genetic manipulation, minor or major manipulation, leads to various kinds of the biological changes and ultimately producing various hormones, enzymes and all that, which is being done by the biochem laboratories. That is a live example for the biotechnology. Here I would like to say, as far as the cancer we are talking about, I want to give some insight that whatever the pathophysiology of the cancer which we always study, and according to we are planning for early diagnosis and management of the cancer, it needs to revisit again and try to find out at the level of the primary prevention, because that's a latest issue of the various journals in which it is mentioned, that we have to just look into the lifestyle, like in breast cancer, which is second common cancer in the females. Since it is a female college, women college, I would like to focus to two things, that is carcinoma of cervix and the breast cancer. Because there is an understanding nowadays which is increasing. They are just linking it to that lifestyle of an individual and dietary habits with that of these two kind of the malignancy, with the hygiene and socio-economic status. And just getting put on the weight and hygiene is also related well. Second is the hormonal issue, that is also related with that of causation of this kind of the cancer. Third is, you must have heard of that if the cancer is not able to detect early, and I just want to give insight, certainly they are the markers we have to see the efficacy, sensitivity and specificity of all the markers which they have just introduced and compared to others, how sensitive and specific are they, and we recommend in routine to everybody or not, whether they to be marketing or they are available, whether they are cost effective or not, and affordability is there or not. Second is the issue which is a burning issue. Once the cell starts from the primary site and metastasis there, then it's very difficult to treat. They should find out something method to see the cells which have moved already from the primary site and circulating in the blood and reaching lymphatics and reaching to the other site and causing the metastasis. That is radiotech facilities and other facilities, either ultrasound and many more. We have to just try to find out the circulating cells, they are malignant, so we can arrest there only before they reach to the target organ. This is a bare area which we have to think of and try to make the research to just find out the circulating malignant cells, so can be arrested and before they are reaching to the target organs. Because to treat the primary and localization of the primary malignancy, that is all the difficult, but even that is not much difficult. But if the metastasis is there, then prognosis is poor and very difficult to treat. These are a few bare area, virgin area, naked area, which needs the exploration. And I suggest if the scientists want to think about the cancer, similarly about the carcinoma of cervix also, we have to compare with the various technologies which are comparable and detect the cancer, and comparable results are there as far as the microscopic findings are concerned. These are the few issues which I want to interact with all of you, and the growing scientists which are sitting in front of me, very young, energetic and committed people. They should think, because research is nothing but whatever the things which we see around, we have to just see and recognize the problem. Whatever we see in general life, routine life, and what can be the cause and effect, if we can think and understand कि भाई इसका क्या कारण है, हम में ये कारण है, हम इसको फॉलो करते हैं, अगर इससे बचा जाए, अगर स्मोकिंग नहीं करें तो कई तरह के कैंसर से बचा जा सकता है, कई तरह के कॉर्निया आर्टरी डिजीज से बचा जा सकता है, हम डाइट में ये चेंज करें तो शायद हमारी बहुत सारी बीमारियां हैं उनसे बचा जा सकता है. These are the issues in routine life. You have to realize what can cause what, cause and effect, which can be understandable by the common people, by the common students, not necessarily you should be genius or scientist. What could be the possibility to find out, to recognize by, not by mammography, by simple breast examination. Every week if you do, you can recognize very quickly. That is a hand mammography. And you can just find out whether there's any nodule palpable in the breast or not, recognize immediately, and just reach to the doctor and find out what it is. These are the many simple ways and means. What I want to say, you have all capacity to think of, and you have all the capacity to find out the solution. But the most important thing is that you have to just have the knowledge, background, that there's a hard disk that is in terms of cognitive function, where you store your knowledge, whatever you see, what you have learned, what you have acquired. Then finally, these cognitive functions to be used by the psychomotor function. Whenever it is required, then you must have seen, compare with the computer. You click and find out what is there. But you will not get the answer of what is not there in the hard disk. The cognitive function is comparable with that of the hard disk, that you have to acquire the knowledge, not necessarily only the bookish knowledge, but whatever you see in around, that is the knowledge you acquired and put there. Then psychomotor to just think of and to use that knowledge, okay, why these occurs, what is possible to detect it early, what is a possible cost-effective investigation, and the treatment as a scientist. Then there's a communication, as that's a very important thing, that you should be very good and very excellent at the communication. As Dr. Bihari has shown that newspaper cutting, the 200 patient, one physician is examining, that is a big stress to the doctor. Doctor is very prone to get the stresses at all the levels. In emergency also, because of the crowd also, because to sort out the problem of the patient also, they are very prone to get hypertension, coronary, and many more things. Then to just minimize the stress by decreasing the number, that is a preventive step, as we are taking for the SMS, I want to communicate to Dr. Biyani and others. In the south, in our campus, we are going to start a 1,500-bedded hospital, so the deloading of the SMS can be done, and the stress level can be reduced. One doctor examining 200, that can be minimized. Second step which we took, that we strengthen the Jaipuri hospital and increase 100-bedded to 500, to ultimately the outdoor of the Jaipuri increase from 200 to now 1,500. That's the other way to deload the SMS. These are the preventive measures as I have just mentioned about you. We had the collaboration, although we want to pursue the collaboration with the Japan at the university level also. So far, the Biyani's college has got any kind of the collaboration and they are doing good. Now we want to just uplift and bring it at the university level also, because we have already collaboration with various American and European universities for the exchange program and the research also. We have submitted many projects for the research, and we are getting the quite handsome grants for the research also. And we had given, we just kept more than, to say, 10, that's about more than 1.5 crores of the rupees to give the grant for the small project to the students, to just give them or just extend the travel fellowship also to the young teachers and young students for the innovative work, for the research, for the small project, for the pilot studies, and to travel abroad in India to present their work, to encourage the young and energetic people. Your mind is raw, your mind is flexible, your mind is thinking too much, better than us. You are very fertile, your mind is very fertile. I just give you the message to all of you. Try to think, that is the key of the research. Try to just find out the solution. Think about the problem, try to just find out and think about the solution. Once I was in Australia, my mentor asked me something, but I didn't know the answer, I was thinking. Then after some time, he just asked me, oh, why didn't you reply? Then I mentioned, I'm thinking. Oh, you Indians thinking also? Means the thinking is the key of everything. If I am thinking, then I can find out the solution. Think in around and be observant. That's very important thing. Be observant. And third is, of course, the mentorship is the key of all these things to teach you. Because what I feel as a mentor, how do I define what will be the fate of an individual? Rightly said by the Dr. Biyani also. One is what I'll be. In what way, whether I'll be scientist, whether I'll be thinker, whether I'll be engineer, what I'll be. Whether I'll just study or not study, whether I'll be politician, whatever I am, what will be my fate. That is decided by, one is by the God. God in the terms of the genetics and genetic manipulation decides your fate, and manipulate and hybridization make something different than already existing. Second is acquired. Acquired in the life, the environment, and where the mother is the master of training, she is the master trainer. I like to say parents are the first mentors to a child before going to the school. Then comes the role of the teacher. Teacher is a great mentor and just change the life of an individual like anything. That's what I will say. Genetically we are not bad. Few are outstanding, but most of the young people genetically, they are engineered by the God very nicely. Now the matters what? That is the environment which starts from mother, father, then the teachers, and finally your hard work. They make you the observant, they teach you the manners, they teach you the ethics and everything, and they inoculate the habit of studying and the habit of just thinking. That's the most important. If somebody asks me what I want to give the message to the teachers, to just develop the habit of thinking, studying, and hard working. It's okay, let them study. Just like a free bird in the sky, leave them. Like just throw them in the sea to float them. Allow them to use their mind, the activity, interactivity, and ask them to speak more and more about any subject. Give them liberty, wrong and right. That doesn't make any difference. I always give this message to and want to convey to you and to your teachers. Allow everybody to speak. Whatever there should be speech freedom as far as the science is concerned. Let them think. You should not be just feel shy in speaking about. I was very shy when I was a student, a small boy, during medical college also. But my teacher, who just appreciated me, and during my residency, he just prompted me, it's okay, you speak more and more what is wrong or right, it's okay, you speak out. That make me certainly, there's a great change in myself, and ultimately because of that I am here today, because of the blessing of God. Second is the blessing of the parents, and third is the blessing of my teachers and mentors. I am grateful to my parents, to the God, and to the teachers, and finally to your teachers also. They try their best to just inoculate the good habits and the science in you to bring them at the highest level. I just pray to the God. I wish all of you will flourish like anything in your life. Thank you very much. Jai Hind.
Thank you so much, sir, for your valuable and memorable presence in our event, which is a great honor for all of us. Your profound knowledge and suggestions which you shared with us today would be helpful for all our students and college. Ladies and gentlemen, a man of illuminating ideas and having such a great personality, Professor Raja Babu Pawar Sahab, Vice Chancellor of Rajasthan University Health Sciences. Please give him a big round of applause.